Today I'm at Chinook Dental Group and I'm joined by prosthodontist Dr. Morgan Gwynn. Now, here at this clinic, you really undergo a lot of life-changing procedures, and as a prosthodontist, you're commonly involved in those procedures. Let's talk about what it is that you specialize in.
Yeah, so most people have never heard of a prosthodontist, but if you think of a prosthetic limb being replacement for a missing limb, prosthetic teeth is replacement for missing teeth. So it could be anything from you chipped a corner of your tooth, it could be multiple teeth, it could be that you've lost all of your teeth and we're doing dentures.
And here at Chinook Dental Group, you do have other specialists. You're one of 4.
Yeah, so we've got our periodontist, so gum specialist, our root canal specialist, our endodontist, myself, the prosthodontist, and then we also recently added Dr. Kwa, who's our oral surgeon.
Wow, and collectively you really can work together to plan out these types of treatment plans. Let's walk through this case study here. This was a hockey puck trauma, something that you often see clients and patients come in for.
So sports traumas, especially in the front, can be quite complex because we're not just dealing with a tooth that's broken, but we're also dealing with their smile. We're dealing with someone who has, do they have a high smile? Are the gums involved? Are the teeth broken? Is the nerve involved? So we have a lot of complexity that needs to be considered. So this patient, he wasn't even in the game. He was working the box, had a puck to the face, lost 2 crowns and a veneer off this tooth, and also fractured this tooth below the gum line.
Ouch.
Now, initially when he came in, they had also lost all these crowns. We couldn't find them. So he had absolutely nothing in his mouth, and he works in a public-facing, high-powered profession, so we couldn't just let him go without teeth. So we tried to put him back together as best we could that day in the emergency, but then we started getting a little deeper into the planning. So most people, when you see this, would think that this tooth is hopeless. We have to take it out. Let's put some implants in. But the key is we need to start with what's our final goal for this patient? What should it look like at the end so that we can start with where we are now and then figure out how to get there. So for Mr. W, for this patient, we had a tooth here that was a little bit short compared to our ideal. This was our broken tooth that was totally broken down to the gum line. And when we see this, we were able to actually harness our periodontist in this case to expose a little bit more of that tooth, create a more balanced gum line for us, and then also treat the nerves on these teeth because they had broken so far with our endodontist, so all seamlessly within the same practice, talking directly to each other and really able to communicate exactly what our needs are for the case. And so with that, we're able to plan everything out, have the treatment done. This patient was able to have something fixed that whole time. And then we ended up with an implant and 2 crowns here.
Very educational. Thank you so much, Dr. Gwynn. Now, of course, if you're interested in learning more about reconstruction, full mouth reconstruction, or about Chinook Dental Group, you can always visit the website chinookdentalgroup.com. Today, I'm at Chinook Dental Group, and I'm joined by oral surgeon Dr. Choo-Soon Kwa, who's one of 4 specialists here in the clinic. And as an oral surgeon, you worked predominantly with the prosthodontist here on this case, Christina. Now, you can see this is a form of full mouth reconstruction. Walk us through what you guys did here. The transformation is incredible.
Sure. So these are before and after photos of Christina, our lovely patient. So she had come to us with complaints of being unhappy with her smile, unhappy with her function, being in some pain, as well as loose teeth. So as we can see from the before photograph, she's had a multitude of issues that she's neglected for the last couple of years. She decided to go with Chinook Dental Group, so I worked on this case with Dr. Gwynn, our prosthodontist. The case involved removing all of the teeth, as well as placing multiple dental implants in strategic positions in order for us to actually fixate false teeth or dentures onto those implants. And this was all done in one day. Surgery took about 3 to 4 hours. Our prosthodontist was able to fixate the temporary set of dentures, which we can see on the right side of this image, on the same day. So this is actually the next day after the surgery.
That's incredible, and that's sort of the benefits of having these in-house specialists. It's yourself, the prosthodontist, Dr. Gwynn, as well as an endodontist and periodontist. Now, of course, you couldn't really complete this without the help of technology in the clinic.
That's right. Here at Chinook Dental Group, we have a multitude of newer technologies. So number one being something called a cone beam CT, which is essentially a mini CAT scan that visualizes the skull as well as the teeth. So that gives us a good representation of the anatomy to help us plan these cases. Another very, very important technology that we utilize is an intraoral scanner. So that creates kind of an image that allows us to merge that data set with the cone beam CT to plan these kinds of surgeries on a computer before we ever get into the operating room.
Right, it gives you a lot of that precision.
Yeah, we get a lot of digital planning completed before. This is in conjunction with photographs, of course, to ensure that we get the result that we want.
That's right, and the fact that you were able to work with those prosthodontists together really streamlined this. Like you said, you were able to get it done in one day. That's an incredible transformation. Congratulations, and thank you for your time.
Okay.
And of course, if you're interested in learning more about full mouth reconstruction or about the Chinook Dental Group, you can always visit their website, chinookdentalgroup.com. This morning, I'm at Chinook Dental Group, and we've been talking about full mouth reconstruction cases. And Kevin here joins me now. He is a patient who underwent a double arch implant reconstruction, and it was life-changing, Kevin. Tell us about what brought you to Chinook Dental Group.
Trial and error of failing at other places led me to come to this place, and it was the best decision I ever made.
Yeah. This is something that you've been dealing with for decades, since you were 10 years old. You underwent an accident?
Yeah, there was an accident in a shop that a piece of equipment hit me in the face and caused a whole bunch of problems that have been continually causing problems from 10 years old till about a year and a half ago, 2 years ago, until I found Chinook Dental and got some new teeth.
So you first got implants around the age of 20, and you were saying that about 6 years ago they failed. So the picture that we see right now behind us, this is what you looked like before coming to Chinook Dental Group, and now this is after. This is incredible. And it took you several consultations. You were looking at several specialists, several general dentists, and you didn't really have much hope.
I was everywhere. I had been to general practice, and I had been to specialists and denture clinics. I had given up and I was ready to just say, fine, give me dentures. I didn't want dentures. I don't think anybody really does. But yeah, I had given up.
What was different about this dental clinic?
I was extremely filled with confidence when I came here. They were very informative. They knew everything about what they were doing and how to do it. I found their team performed just perfectly all the way through. I didn't have any issues with any part of the whole process.
How pleased are you with the results?
1,000,000%.
Even better than your original implants.
Oh, the best teeth I've ever had. These are even better than my original teeth when I was a kid.
Oh, that's incredible.
Yeah, they're awesome. I can't say enough good things about them.
That's so nice to hear, because we are hearing a lot of these types of cases where they have been life-changing. And so when it does come to this type of reconstruction procedure, it's not just aesthetics, it's comfort, it's also function.
Exactly, and the thing that I liked a lot, the other places were trying to put dentures in because they didn't know how to, I think, properly articulate the work. But as soon as I came here, these guys knew exactly what to do, because I have really low sinus cavities, so implants were going to be a problem, but they knew what to do, and here we are.
They had a game plan right away.
Yeah.
Thank you so much, Kevin.
For sure.
Of course, if you're interested in learning more about Chinook Dental Group, you can always visit the website, chinookdentalgroup.com.